11:28 on your coffee break on HANradio.com and streaming on the HAN network. I'm Kate Chaplinsky with John Kovach, and we're joined by a special guest right now from Griffin Hospital, Eunice Lisk, who is co-director of the Wellness for Life program at Griffin Hospital. Welcome.
Thank you. Thank you so much for having me today.
Can you tell us what Wellness for Life is all about?
Sure. So the Wellness for Life program is a lifestyle change program that participants come into that are really ready to make some lifestyle changes to get them healthier and to keep them healthier. We're looking to kind of change their scope of health, but also prevent a lot of chronic diseases.
Right, and that's, I think, the interesting part of this is you're trying to treat them maybe before there's bigger issues down the road, which is sort of unusual for a hospital that's kind of in the business of taking people when, things don't go so well.
That's exactly right. I mean, I think people think of well care or health care as kind of taking care of you when you're sick, which is usually what it does. And we're looking to take an approach to help people turn the needle, change the needle, and really stay healthy.
And can you tell us, if somebody joined the program, what happens?
Sure. So it's a 12-week program, and the cost of the program is $350, but that includes a one-on-one with a registered dietitian, a one-on-one with an exercise physiologist, a 12-week membership to our fitness center. They also receive a fitness assessment and an exercise prescription that they can do, really for life. They also receive a Fitbit, which is a health tracker to help keep track of their steps and monitor their food intake. They also come for 12 sessions, and each session there's a different health professional talking about a different health topic. We cover topics from nutrition to exercise principles, sleep health. We even have someone come and talk about the power of positivity. So it's a very inclusive program, very hands-on.
What is the biggest thing holding people back from doing this on their own?
That's a great question. We actually talk a lot about that in the group, and everybody really knows what to do, right? We all know we should be getting 5 helpings of fruits and vegetables every day. We should be moving more, sitting less, but people need that motivation. The people in our program also are assigned a health coach, so the health coach can really motivate them, make sure they're staying on track, because they meet every week. And we take their blood pressure, their weight. They're accountable, so they're coming in every week. And there's a lot of group, support that goes on. And I think it's really just them needing that kind of hand, helping hand.
Is it kind of a supportive atmosphere where the members push each other along a little bit?
Absolutely. As a matter of fact, every week when they come to the class, up on the board, we have their number of steps. So they all get to see who did how many steps. Now, it's coded, so they all have a code. They know what their code is. But they can see how they've progressed, how everybody else in the group is doing. And we have a goal every week that we want everyone to get 70,000 steps a week. That's the 10,000 steps a day. So they may say, hey, number 4, you had a great week this week, and we'll applaud them. Or someone who didn't have as good a week, they'll, hey, what's going on? What can we do to help? So it is a great group atmosphere.
And have you seen it kind of changing people's lives? Have you been able to witness that firsthand?
It's amazing. The stories already are just incredible. People telling, first of all, weight loss is a big kind of byproduct of the program. We don't tout it as a weight loss program because it really isn't. But guess what? When you're eating better and moving more, you're going to probably see some weight loss. So we see weight loss, we see decreases in blood pressure, we see better numbers for our diabetics with their blood sugar numbers. So almost every single person has been successful in the program, and it's really astounding and wonderful to see that.
Now, Eunice, how is this something that you got involved in? What's your background?
So I'm an exercise physiologist, and I'm the director of cardiac rehab at Griffin Hospital. So typically I'm seeing patients come in when they've had a heart attack, open heart surgery, or an angioplasty. And, we know that 80% of chronic diseases could be possibly prevented if people were having the healthy habits, a better diet, moving more, not smoking, and working on their stress reduction. So it's been sort of a dream of mine to have a program like this. When I went to Griffin Hospital to the president of the hospital and I told him my idea, he said, what do you need to make this work? And they really gave me all the tools I needed to implement the program, and it's really showing to be very successful.
Right. launched this in 2014. How did that go?
It went very well. We ran a pilot program and really worked with the Prevention Research Center at Griffin to gather some data so we could really see, is this really effective? How are we doing? We also spent a lot of time interviewing the people that were in the pilot program, asking them, what did you get out of the program? What didn't you? What other aspects would you look for? And we've redesigned it every time we've run it to make it really better. And so we're really meeting their needs and their, meeting their expectations.
And how does somebody join or get started in this?
Well, they can certainly go to the Griffin Health website, www.griffinhealth.org. We have a whole page on the Wellness for Life program, or they can call me directly at 203-732-7107, and I can help them with that enrollment process.
And what would you say to someone that's really considering it, but they're just a little fearful or nervous about taking that step?
I think this is what they're looking for. If they're ready to make those changes and they're really, just struggling with some of the issues, this program is exactly what they're looking for because it gives them all of the elements. It's not just a gym. It's not just a dietitian. It's not just a health coach. It's all of it put together in one package. They really get everything with the support they're going to need.
All right. Thank you so much, Eunice. We love having you on to talk about this. That's
Thank
a
you
great
so
program. And again, Eunice, Lisk, Griffin Hospital. Again, how can people find out more?
www.griffinhealth.org.
All right, awesome. Well, when we come back, we're going to be talking transportation with Jim Cameron. We have a lot more news too. That's all coming up on your coffee break after this.